Good afternoon, everyone. We are the Group 4, and for today, we are going to present to you Robotics and Artificial Intelligence, presented by, starting with, Monroy Mary Pauline, Librodo Ayla Caris, Orpeza Brianna Angel Marie, Palanog Diane Ilorin, and yours truly, Diaz Christian Paul.
So for our first topic, we have artificial intelligence in health diagnostics. So before I will tackle about that, I will first present to you a short video clip about artificial intelligence in medicine.
Artificial intelligence is revolutionizing medicine, but how can this potential be used in the best possible way? For example, if a patient is worried about their health, they can quickly obtain initial diagnoses with a symptom checker app. The app also helps patients decide whether they should see a specialist, and if so, which one. The app's algorithm provides the doctor with valuable information for taking the patient's medical history, even in the case of rare diseases, and it can support the choice of the right treatment. Artificial intelligence can be useful during an MRI examination, for example. MRI images consist of hundreds of thousands of individual image data in which neural networks recognize patterns and calculate the probabilities for certain diseases. To do this, they were previously trained with numerous MRI images and the associated diagnoses. The AI-supported assistance systems provide the doctor with important information for her own diagnosis. However, special skills are required to be able to deal with it in a reflective manner. In summary, these two aspects are particularly important. On the one hand, AI systems must be trained with as much data as possible in order to deliver reliable results. On the other hand, doctors need additional skills to be able to make better decisions in the interest of the patient, supported by AI. In this way, the potential of artificial intelligence for medicine can be used in a reflective and competent manner. See you on the AI campus.
Accurate diagnosis is a fundamental aspect of global healthcare systems as it is of central relevance to ensure timely treatment and to achieve safe and effective patient care. Healthcare systems are considered dynamic and changing environments, and medical specialists continually face new challenges with changing responsibilities and frequent interruptions, leading to the diagnosis of disease becoming a side issue for healthcare experts. In addition, the clinical interpretation of medical information is a cognitively challenging task as data is extremely limited and data evolve and patient dynamics change over time, making diagnostics a highly complex process. The unique challenges of modern medical practice and the wide variety of diagnostic strategies can create difficulties for the entire healthcare system, and thus, more systems are relying on information technology. So, what is artificial intelligence? Artificial intelligence is the ability of a machine to perform cognitive functions that we associate with human minds, such as perceiving, reasoning, learning, interacting with the environment, problem solving, decision making, and even demonstrating creativity. So it is generally associated with human like behavior and covers a wide range of research areas, such as natural language processing or robotics. Next slide, please. So the application of artificial intelligence can improve the level of diagnostic accuracy and efficiency as it provides advantages pertaining to the diagnosis of diseases. The importance of artificial intelligence as a component of the diagnostic process has been steadily increasing since building systems became more practical. However, current practical applications, including healthcare and disease diagnostics, are narrowed down to a specific task and are being developed using machine learning. Algorithms exploit medical data to generate predictions and continuously learn and develop over time by continuously processing new and updated data. Algorithms acquire information through different types of knowledge and input or over multiple years of experience. So, therefore, artificial intelligence empowered systems are able to process more knowledge compared with humans, possibly outperforming them for certain medical tasks. Its application within the diagnostic process supporting medical specialists could be of great value for the healthcare sector and the overall patient's well being. The integration of artificial intelligence into existing technical infrastructure accelerates the identification of relevant medical data from multiple sources which are tailored to the needs of the patient and the treatment process. Furthermore, artificial intelligence generates results based on a larger population rather than on subjective personal experiences and achieves equal results when using identical medical data and does not rely upon situations, emotions, or time of the day. Next slide, please. Next slide, please. Artificial intelligence is already utilized to assist medical experts and improve the diagnosis of diseases. For example, in early diagnosis of ectopic pregnancies and helping gynecologists with their decisions about initial treatment. So this progress is due to improvements of technical capabilities such as processor speed and storage capacity, while costs have dropped. Furthermore, the amount of medical data is continuously growing, and systems are now capable of identifying, extracting, and processing information from different sources more quickly than previously. So, in addition, the technology and algorithms needed to implement systems are now widely accessible and can be easily applied and are commonly classified in supervised, unsupervised, and deep learning. So that would be all for our topic in artificial intelligence in health diagnostics. And for our next topic, we have advances in artificial intelligence applications for medical imaging, which is to be presented by Ms. Brianna Angel Marie Orpesa.
For our next topic, we have advances in AI applications for medical imaging. So, for the AI, where computers performs the task are usually assumed to be required in human intelligence is currently being discussed in nearly every domain of science and engineering. So, for the major scientific competitions like the ImageNet, large-scale visual recognition challenges are providing evidence that computers can achieve human-like competence in image recognition. AI has also enabled significant progress in speech recognition and natural language processing, and also all of these advances open questions about how such capabilities can support or even enhance human decision making in health and healthcare. Two recent high profile research papers have demonstrated that AI can perform clinical diagnostics on medical images at levels equals to experienced clinicians, at least in very specific examples. So we have two advances examples in AI application for medical imaging. So to show an impressive accuracy and sensitivity in identification of imaging abnormalities or to enhance tissue-based detection and characterization. Next slide, please. Okay, so first we have the detection of diabetic retinopathy in retinal fundus images. So many diseases of the eye can be diagnosed through non-invasive imaging of the retina through the pupil. Early screening for diabetic retinopathy is important as early treatment and can prevent vision loss and blindness in the rapidly growing population of patients with diabetes. So we have to screening also provides the opportunity to providing indicators of cardiovascular diseases and the increasing need for such screening and the demands for expert analysis that it creates motivates the goal of low cost and quantitative retinal image analysis. So for the next slide, here are the example of diabetic retinopathy. For the number one, we have the internal, the fundus reflex. Number two, the internal, field one, the macula. The third is the internal field 2, the disc. And the last is internal field 3, the temporal 2 macula. And for the number 2, next advances, we have the dermatological classification of skin cancer. Okay, so skin cancer represents a challenging diagnostic problem because it's only a small fraction, like 3 to 5% of about 1.5 million annual US skin cancer cases. These are the most serious type, melanoma, which accounts for 75% of the skin cancer deaths. Identifying melanomas early is a critical health issue, and because of that, the diagnosis can be performed on photographic images, and there are already services that allow individuals to send their smartphones photos in for analysis by a dermatologist. So that are the example of the advances in AI applications for medical imaging. So next topic, we have the moving computational advances into clinical practice and to be presented by Ms. Diane Ilorin Palanog.
Thank you, Ms. Orpesa, for the topic moving computational advances into clinical practice. So for computational methods are recognized as a special type of tool in medical practice and where they impact clinical practice are subject to different forms of regulation. AI-based tools represent a new set of opportunities but lack the extensive basis of experience and validation that is needed for the acceptance into formal medical practice. So how AI-based computational approaches could become sufficient trusted to modify protocols for diagnosis and treatment, enabling improved outcomes at lower cost. Next slide, please. Next slide, please. So we use the example of a new computational tool that requires large-scale computation, but is based on physical properties rather than trained AI algorithm. The example illustrates the rigorous process of review and development needed to validate new techniques for clinical practice. It also illustrates how important the demonstration of the benefits of a new approach is to its eventual uptake as clinical tool. So for the coronary artery disease, next slide please. Can you please go back to the last slide? Thank you. Issues driving interest in improved methods. A large number of patients experiencing chest pain undergo invasive testing only to reach a negative diagnosis. The negative impacts on patients' experience, access to expensive diagnostic facilities, and costs create a strong incentive to develop alternative approaches. The diagnosis whether a patient has coronary artery disease or CAD and will benefit from cardiac revascularization, bypass surgery, or insertion of a stent is based on two primary factors. The first is structural, the narrowing of blood vessels or stenosis around the heart, and the second is functional, reduced flow of blood or ischemia compared with the flow in a normal coronary artery. Direct measurement of stenosis can be accomplished with the invasive coronary angiography, in which a cardiac catheter is inserted to deliver a contrast dye to arteries supplying the heart, followed by X-ray imaging. Direct measurement of blood flow is accomplished by invasive fluid flow reserve or FFR technique based on insertion of pressure sensor through a cardiac catheter. So next is the development of new approaches. Non-invasive diagnostic coronary computed tomography angiography, or the CCTA, has been established as non-invasive technique for screening. However, even at its best performance, CCTA, like invasive coronary angiography, has limited ability to discriminate which cases of stenosis are truly causing impaired blood flow. Recently, advances in computational fluid dynamics or CFD and in physical understanding of arterial behavior have enabled computational determination of fluid flow reserve computationally using CCTA as the for the structure. Development and validation for clinical application, a private company, HeartFlow Incorporated led development for the FFRCT technology for clinical use. Please go back for the previous slide. Yeah, thank you. In 2014, the company received FDA approved to market the technology based on its demonstration of substantial equivalence to predicate devices. In parallel, additional studies were underway to establish whether FFRCT is a feasible alternative to invasive coronary angiography and the potential use as the direct diagnostic for CAD-induced reduced blood flow requiring revascularization. So next is the summary points for developing clinical applications. The FFRCT example illustrates key issues for new computational technology to enter the practice. So the technology should address the significant identified clinical need. Next is the technology must perform at least as well as existing standard approach. Ne- um, then substantial clinical testing is needed to verify the performance of the new technology under the wide range of clinical situation in which it may be used. And lastly, the new technology should provide improvements in patient outcomes, the patient quality of life, practically in use and reduce medical system costs. Because the FFRCT technology is based on physical principles rather than the less understood correlations of AI, its review and acceptance process likely faced less skepticism than a few AI approach may encounter for the medical community to develop trust in AI-based tools. Assessment at least as rigorous will be needed. And for the next topic, which is the nursing robots, will be presented by Ms. Ayla Librodo.
For the topic of nursing robots, nurses constitute the backbone of the healthcare industry, and the nursing profession itself has typically been the largest segment of the healthcare workforce. So, as an integral part of patient care, nursing is required to constantly adapt to changes in the healthcare system as well as the wider financial and societal environment. Nursing robots are specially designed systems that have the potential to ease the burden on nursing staff within hospitals and nursing homes by reducing the number of visits,
but also to undertake general assistive roles at home without compromising a quality of care while improving quality of life. So, a role for nursing robots and it may effectively relieve burden from nurses, allowing them to concentrate on tasks pertinent to their primary duties. So, robotic machines have already been considered to support processes including distribution of food trays, medicines, and laboratory specimens throughout a hospital. Robots may also automate logistic tasks, and works alongside or collaborates with nurses to support their work and enhance efficiency. Moreover, robot nurses can help reduce occupational exposure of human nurses to hazardous infections or chemicals. Specially designed robotic systems help with patient transfers, ambulation, and lifting may significantly reduce physical stress on nurses. It is common for caregivers to suffer from back pain and job related illnesses. And nursing robots may also provide services for telemedicine purposes. So, robotic nurses accommodating telepresence platforms can effectively serve as interfaces for doctors to communicate with patients over distance. Typical scenarios involve routine virtual visits where the robot navigates to hospital with the examined patients. Additionally, the robot may also capture the patient's vital signs at various intervals. This further extends to the patient care center situated in remote and isolated areas. So there are also two types of nursing robots, the socially assistive robots and the physically assistive robots. The socially assistive robots provides assistance to end users through social interaction, and physically assistive robots used to improve the independence and quality of life of individuals with disabilities. The potential uses of socially assistive robots include companion robots, supporting adults with dementia, motivating physical exercise, and providing post stroke rehabilitation. Next slide, please. The primary role of companion robots has been to act as interfaces for the elderly to enrich their social lives while connecting with their families and friends. So among the capabilities of socially assistive robots is to monitor elderly patients via video and also provide alerts to caregivers on patient activity. Moreover, robots may also provide older citizens with news and entertainment information, reminders for medication adherence, as well as facilitate physical exercise. Socially assistive robots concern supporting people suffering from dementia and supports regular physical exercise. So exercise is an essential in elderly individuals to maintain and improve health status, support mental and physical well-being, and reduce the likelihood of depression. Robots have been designed to engage elderly users in physical exercise, facilitating workout sessions while evaluating user performance and providing real-time feedback. And the use of robotics also extends to post-stroke exercising and rehabilitation, which typically involves carefully designed repetitive passive or active exercises. In either case, a movement therapy robot may provide a diagnostic or therapeutic benefit. The physically assistive robots has two key elements of independent living that are directly associated to quality of life of both the elderly and patients. So these are the preservation of mobility and the ability to manipulate objects. So in elderly populations, a wide variety of medical conditions ranging from stroke and neurodegenerative diseases to bone fractures and decline of muscular power lead to the loss of mobility. To combat this situation, robotic solutions have been proposed to provide assistance required to stand up, sit, and walk. Robotic wheelchairs provide users with autonomy, enhanced mobility, and safety. With an appropriate mechanical structure for robotic wheelchair, architectural barriers may be overcome, including curbing and ascending. And appropriate designed assistive robotic manipulation systems can support people with motor impairments, such as limited hand and arm movements, high level spinal injuries, or tremors. Their surveys have identified the relevant needs of disabled people in the group regarding assistive devices to carry out activities such as eating and drinking, personal care, handling objects, mobility and access, and general reaching and moving tasks.
And for the famous nurse robots, this is just an additional information. So the first famous nurse robot is Robert Denso. Robert Denso is used by Thai and Japanese hospitals for patient care. Robot Denso monitors elderly patients via video and sets up video chats with their relatives. It also alerts caregivers of patient activity by phone. Additionally, it provides reminders for medication and exercises alongside the elderly, and it also provides entertainment by offering games and karaoke. The second famous nurse robot is Robot Paro. So this is a seal-like robot used in hospitals and extended care facilities the world over. It stimulates interaction between patients and caregivers. It also helps relax patients by imitating the voice of a baby harp seal. And the last is Robot Pepper. So this humanoid robot works the reception area of two Belgian hospitals. It greets people and guiding patient to their proper department. And it can recognize 20 languages, and it can identify gender, and can identify joy, sadness, anger, and surprise. It can also interpret nonverbal cues like head tilts, frown, smiles, and shifts in vocal tones.
Walking down the hall at Cedar Sinai, you may meet Moxie and its twin, Moxie, Cedar Sinai's brand new robots. The robots are here to help the nursing staff with simple yet time-consuming tasks.
Moxie delivers items from central issues, either that are too heavy or just don't fit in a normal system. So like IV pumps, sani wipes, which are cleaning wipes, chair alarms, cushions for patients. She can go to the gift shop and pick up items that a patient may have purchased.
For nurses, requesting Moxie is as easy as making a phone call or sending a text.
You basically search Moxie and her name pops up. Moxie comes up and you just text what you need.
Once Moxie receives the request, the robot responds within 5 minutes with a status update and an estimated time of arrival.
We're tracking the turnaround times that Moxie takes to do a task, which is currently running less than 30 minutes, which is great.
Moxie is the product of Diligent Robotics and brought to Cedar Sinai as a pilot program. Marshall says the staff loves it.
They're thrilled that Moxie shortens the time of delivery for things that they're waiting on, like infusion pumps. There's this sense of thrill that they're getting things quicker than they would before Moxie.
But Moxie is more than just a robot delivery system. Both robots have personality and people can engage with them. Moxie's eyes smile with hearts and the robotic arm waves hello.
I think that's one of the big positive benefits from Moxie is the staff get a little energy out of being around the robot, even our patients and families. I just the other day saw a picture of a child in the hospital playing peekaboo with Moxie. It has positive benefits that I wouldn't anticipate.
I think it's important to have Moxie be present at Cedars. I think it not only provides an opportunity to improve workflows and be more efficient, but I think it's a fun thing to see around the halls. Feels very future forward. It's that little connection, even though it's a robot, you still have that, you're my friend, you're my helper, let's work together.
We now proceed to telerobotics. So within the wider field of healthcare, teleoperated medical robotic systems have been successfully employed, allowing procedures such as surgeries, treatments, and diagnosis to be conducted across distances while utilizing wired and or wireless communication networks. Recent developments in telerobotics and their enabling technologies, such as robotic manipulation, video streaming, and telecommunications, all constitute nursing and assistive robotics more effective and widen their application fields. Robotics hardware enhances telepresence to a more natural and effective level through mobility and performance of manipulation tasks in the remote environment. Telerobotics solutions pertinent to nursing may facilitate the doctor's virtual visit scenario. Using an onboard adjustable camera, the user may remotely drive the robot to locate a patient in the clinic and or provide a set of destination points to which the robot will autonomously navigate. Bidirectional video conferencing then allows the doctor to appear on the robot's screen and engage in a dialogue with the patient to assist and to assess his or her current clinical status. So this is otherwise known as telehealth. Real-time medical charts can further complement and enhance this remote clinical assessment using a robot-mounted device equipped with vital signs acquisition capabilities and EHR connectivity.
Next is telepresence robots supporting elderly persons at home may facilitate social interaction, help the elderly to remain socially engaged, and allow relatives to make virtual visits and experience the feeling of close proximity. They also enable contact with doctors and nurses to remotely monitor their health and provide the required support. Compared to video calls, a telepresence robot enhances interaction to a more natural level through the mobility of the system. Enhanced capabilities of telerobotic systems are possible through their internet compatibility with IT technologies, including Internet of Things or the IoT. In various telepresence robotic systems are reviewed and three main areas of application of telerobotics in elderly care become apparent, namely telemedicine, remote interactions with other people, and telehealth monitoring. The next topic is the Bionic Arms Enhanced Control System, which presented by yours truly. Next slide, please. What is a bionic arm? A bionic arm is an electromechanical device that attaches to the human body and attempts to replicate the functionality of a natural arm or hand. It always consists of a bionic hand or a partial hand, and depending on the level of amputation, may also include a powered wrist, elbow, or a shoulder. Th- this particular line of device always includes a powered wrist, but this is a potential or not available for other devices. Also, in some cases, the hand may be replaced with a powered hook or a clamp. Next slide, please. How a bionic hands function. The bionic hand dexterity begins with the mechanical design of the fingers and working backward. The core mechanical function of a human finger is to open and close. Next slide, please. A battery-powered motor drives a gearing system to move the main joint, which then moves the second and the third joints via a bar linkage system. And others are using a pulley system to stimulate tendons instead of a bar linkage system. The movement of a natural thumb is even more complex. In addition to opening and closing, it can rotate down and slightly outward to touch the entire underside of any finger and even parts of the palm. This allows in natural hands to grasp objects of any shapes. Despite its mechanical complexity, this type of thumb still has many limitations. Yes, can position itself to become an opposing force for some many grips, but it can lack so. lacks the dexterity of a natural thumb. Next slide, please. So here's a video presentation in relation to how bionic hands function. Please stop the presentation. So let's proceed to the user of control systems in the bionic arms. So when you move a natural limb, your brain sends nerve signals to the muscles, which in turn move the limb, specifically if the limb is amputated. The brain still sends these signals even though some of the muscles are no longer react to them. The general concept behind bionic user control system is to intercept the brain signals to convert them into commands for the bionic device. So here's a video presentation in relation to bionic arms for user control system.
We use our hands for so many things, not just performing the tasks of everyday living, but communicating and expressing emotion too. The loss of your hand can mean a real loss of independence and identity. There are some really nice prosthetic hands on the market right now that offer great flexibility of movement. They can almost replicate the full range of movement of the natural hand. But controlling them is really difficult, so they're not used to their full potential. If we can provide technologies that improve the control of prosthetic hands, then we can help people to regain some of their lost independence. What we're trying to achieve in our work is natural, intuitive control of prosthetic hands. So-called myoelectric hands use electrical activity in the remaining muscles to send control signals to the motors of the prosthetic hand. But the number of signals you can record is limited, and that limits the movements you can make. In addition to that, the lack of feeling or feedback given to the user leads to unnatural control. That is, users are missing the sense of touch, the force on the fingertips, and the sense of where the hand is in space, how open or closed the fingers are at any given time. This means that users have to focus really hard on controlling the devices, and control isn't very natural.
We use computer modeling to improve the control of prosthetic hands. The computer model can predict the natural movement of the missing hand from the recorded muscle signals, and these movement instructions can then be passed on to the prosthetic hand.
One of the advantages of this approach is that by including knowledge of the biomechanics of the hand, we can make better predictions about what the user is trying to do from the recorded muscle signals. In the future, when we have access to more information from the remaining nerves of the residual limb, we'll be able to control more detailed movements of the hand than we can now. Another advantage of the model-based approach is that we can estimate or predict information about muscles which are, in fact, not present. This is the information on which proprioception, or the sense of movement of the hand, is based. Ultimately, this will provide the sensory feedback that's currently missing from prosthetic hands, and we hope will enable more natural control.
When you come to see us at the exhibition, we hope to give you a real sense of just how complex and fascinating our hands are. We will have a physical model of the hand that you can play with to see how hard it is to achieve good control. You will be able to interact with our computer model to gain some insight into what your muscles are doing as you move your hand around. And we will also have a robotic hand that you can try to operate with your own muscle signals.
Next is surgical procedures. Before the bionic hand attached to the human, so it is a must to undergo a surgical procedures. So the surgeons have to reassign severed nerves for reduced limb pain and improved muscle control in residual limb. And then reconnect severed muscle pairings to restore proprioception and implant electric sensors to improve the detection of interpretation of the muscle movements and attach electrodes to the nerve bundles to facilitate sensory feedback and also insert a metal rod in the upper arm or the humerus to act as a superior prosthetic connector and eliminate the need for a socket. Next slide, please. And here's the current bionic hands. First, the Atom Touch and the Look Arm are modular system that can be configured for any level of amputation below or above the elbow. The Look Arm can use a full range of control system, while the Atom Touch relies on the highly advanced control system driven by artificial intelligence. Next slide, please. And also, these are the current partial hand or finger options. Nearly two-thirds of the upper limb amputations involve finger or partial hand loss. This equates to millions of people around the world who are missing fingers, parts of the fingers or a part of their palm. Both these inventions created excellent bionic partial hand prostheses, but these are not well suited for heavy loads or changing environments. For and that's all for our presentation. Thank you.